Welcome to the Cruz Orthodontics podcast. Today we're talking to Dr. Cruz about the Synapse dental pain eraser, and we're going to explain how it can reduce pain throughout your orthodontic treatment. So how did you come across a dental pain eraser, and how do you incorporate it into your practice?
Yeah, good question. I had a colleague actually here in San Diego introduce me to the Synapse about 6 months ago, and I called the company, had them come out to my practice so my staff and I could test it on ourselves, and I was immediately impressed. From there, we actually tested it on our patients in the office during procedures that would normally cause discomfort, and it also performed really well there as well. And then from there, we fully adopted the Synapse into our practice. So now we give it to all of our patients to use at home as they need it.
So I understand that Synapse dental pain eraser uses neuromodulation. Can you explain what that is and how you incorporate it or help people with dental pain?
Yeah, sure. I'll do my best. In its most simple definition, neuromodulation involves changing a nerve's activity via either electric pulses or pharmaceutical agents like drugs to a specific area. So, in other words, changing the way a nerve would typically behave. As it pertains to dentistry, pain is always one of the biggest deterrents to treatment. As an orthodontist, I'm constantly having to alleviate patients' concerns about how much pain they will be in from having either braces or Invisalign. So anything we as clinicians can do to minimize or eliminate pain is celebrated by our patients. So that's where neuromodulation with something like Synapse comes in. We now have a way to change the way nerves in teeth behave without needles or anesthetics, allowing patients to experience treatment pain free. It's pretty cool stuff, and feedback from our patients has been great.
So how does the Synapse dental pain eraser actually block the pain signals?
There's a whole cascade of events that take place in a nerve cell in order for pain to be triggered.
Hmm.
The synapse blocks this chain of events by doing a number of things. I'll try not to geek out and go into too much detail, but on a cellular level, the synapse sends small electric pulses to block calcium ion channels and also block the release of specific peptides or proteins known to trigger pain. It also reduces the release of histamine. The science behind it is quite impressive. I tip my hat to the researchers that came up with this technology.
Can you elaborate on what pulse wave technology is?
Sure, the pulse wave technology is one of the keys as to why the Synapse dental pain eraser is so cool. The company's figured out a way to create gentle electric pulses through the synapse to calm nerves and eliminate pain. The benefits to this is that the pain relief is immediate, it's drug free, and it's long lasting. It can last up to 2 days. We used to be so dependent on drugs, ibuprofen or needles and anesthetic. And so, that's now all eliminated because you've got this pulse wave technology to send these pulses into the tissue and calm the nerves down. So yeah, when you think of the alternatives for pain management, this is definitely a no-brainer.
So how does this device reduce pain through the peripheral and central nervous systems?
Yeah, the peripheral system we discussed a bit already, and that has to do more with the blockage of the calcium channels and the protein release. But in addition to that, the electric pulses from the synapse also change the way that your brain communicates with your nerves, essentially shutting down your pain response centers. It's one of the things that's so impressive about the synapse. It works on multiple levels, which is why I think it's so effective.
Can you explain the process for using dental pain eraser during treatment?
Yeah, it's incredibly easy to use. You basically turn it on, rub it on the desired area for 20 to 30 seconds. You do need to make sure that the area is moist so that the electric pulses can be conducted through the tissue, which really isn't an issue since you're working in the mouth and most things are already moist anyway.
So Dr. Cruz, what types of pain is it most effective with?
The pain relief is nearly immediate. It works on any pain that occurs in the mouth. So all types of tooth pain, various sores inside the mouth, like canker sores. It's helpful post surgery, gum surgery, grafting surgery, for example. And obviously, what I use it for, which is soreness from orthodontic treatment.
So, how long does the relief it provides last?
The relief can be anywhere from 1 to 2 days, which is pretty incredible when you think about the alternatives. I mentioned ibuprofen or Advil. Maybe you'll get 6 to 8 hours of relief there, or even topical anesthetics that you'll actually place on a sore, which maybe last for an hour or two.
Hmm.
So the Synapse far exceeds any of the other alternatives that are out there.
So, who can safely use the dental pain eraser? Is there an age limit?
No age limit. The Synapse is incredibly safe, and it's approved for all ages. And I know it's hard to believe, but with zero adverse effects or allergic reactions reported in all of their testing, and so that is very impressive to me. And that's what gives me peace of mind versus administration of pharmaceuticals or drugs.
So, how do you clean and maintain it specifically for home users?
Yeah, it's super easy. At home you can rinse it with water, or if you want to, wipe it down with isopropyl alcohol. If you really want to disinfect it, but it's durable and really easy to clean. Basically, wipe it down.
So, has the Synapse dental pain eraser been cleared by the FDA?
Yep, it's been cleared by the FDA, which legitimizes its technology and its safety profile. That's what gives me the confidence to prescribe it to all of my patients. There are a lot of different products on the market that don't have FDA clearance, and there's always kind of this cloud of doubt over my head as to one, whether it's effective, and two, whether it's safe. And so that FDA clearance for the Synapse definitely gives me peace of mind.
So, how can patients acquire the Synapse dental pain eraser?
There are a number of dental offices that are embracing the Synapse technology. Um, you know, Synapse, the company itself, had done a tremendous job in winning a bunch of pretty prestigious awards. Last year, 2023, they actually won the AAO award, Product of the Year. And so that gave them quite a bit of positive publicity. So you're seeing a lot of orthodontists around the nation that are starting to adopt it. I think it will be widespread in the next few years. As of right now, I'm the only orthodontist in Chula Vista that offers it.
So they can just visit your office, and when they're a patient, they can get that eraser.
Absolutely. As of right now, we're giving it to every single one of our patients that starts treatment.
So when someone brings it home, is it disposable? How long does it last, etc.?
The home version can be used for 100 minutes, which should last the duration of most orthodontic treatments. We actually send our patients a text reminder the night before their appointment to use their Synapse to prevent any discomfort they might experience during or after their adjustment. So, in other words, we like to stay in front of it rather than it being reactionary. So, on average, most patients will have 10, maybe up to 20 appointments during orthodontic treatment. So that leaves them with plenty of minutes on the device to last the entire treatment time.
Do you have any feedback from your patients that you can share with us?
Sure, yeah. All of our patients have had positive feedback, but the patients that rave about it are the ones that have sensitive teeth in general, where every procedure is uncomfortable for them. We had an Invisalign patient recently where we removed the little attachments or bumps from his teeth, and he could barely tolerate it or stand it. Usually, this doesn't bother our patients, but in this case, it really set him off. So we stopped. We used the Synapse for a couple of minutes, and then we tried again. He couldn't rave about the Synapse or give it high enough praise. It was really gratifying, actually, for me and my staff to make such an immediate impact. We never want to cause discomfort for our patients, and it always hits me hard when I do. I think that's one of the reasons why I'm so excited about using the Synapse. It helps create a pain-free environment for my patients, which in turn makes my staff and my job more rewarding and less stressful.
So what do you see as the future of neuromodulation for orthodontic care in general?
It's a good question. Synapse has really done a great job in offering a safe, portable device that's ridiculously easy to use. So I'm not sure where you take it from here. I don't think it's a matter of improving the technology. I think it's more a matter of education and exposure so that more offices embrace it.
So Dr. Cruz, do you have any plan to expand the use of technologies like Synapse in your practice?
I I'm not sure I can embrace it any more than I do. As it stands now, every one of our patients gets the Synapse when they start treatment. In
Hmm.
fact, I offer it at no additional charge because of the value that I see in it. And I just don't want there to be any sort of obstacle for any of our patients to be able to use it.
Well, great. Well, Dr. Cruz, thanks so much for teaching us about the Synapse dental pain eraser and how you incorporate it in your practice. Look forward to talking to you next time.
Yeah, my pleasure.